Hey, good evening, video discussion board. Today we're comparing the interprofessional roles. So far this semester, I have shadowed Beth, who's the case manager at Coastal Carolina Hospital, and Ashley, who's the diabetes navigator and care coordinator at St. Joe's in Savannah. So I'm going to start with Beth. So case manager, she works behind the med-surg nursing station at Coastal Carolina Hospital. So as the case manager for all of the inpatient care in like med-surg, ICU, the emergency department, and even labor and delivery, she facilitated and coordinated any necessary continued care for any of the patients. So her role, so for her daily grind, basically consisted of she showed up at 7:30 in the morning. She pulled up all the patients, like all the patients' profile, and she goes through all the patients, all of their profiles, and she went through patient by patient and read all their notes. I guess all their diagnoses, their treatment, the rehabs, any updates, etc. And then after she goes through all the patients and reviews all their information, she attends a tempo meeting. So at the tempo meeting, this is like maybe one of the bigger parts of the day early on, because then she meets with all the nurses and doctors who are caring for all these patients to determine their discharge planning with a color code. So it's either green, yellow, or red. So green means they're ready to discharge and they gotta get some ducks in a row, but discharge today, probably. Yellow means discharge maybe tomorrow, because they got a few more tests to pass and, bridges to cross, I guess. And then red means the patient would have no discharge plan anytime soon. They're kind of sitting there for a minute. So then Beth prioritizes the green and the yellow patients, and she goes to interview them, making sure they're ready for discharge. This includes any assistance they need at home, any durable medical equipment they need to get or have, transportation needs, and any personal concerns. She then informs of any programs that exist that can help them with these concerns, and how helpful their insurance will be through this process as well, because she kind of helps put in the request to the insurance and lets them know how that's going to work out. Her collaborations were mostly with the doctors for discharge, as well as some booking spots or beds in rehab facilities, in skilled nursing facilities or SNFs, setting up home health care, or sending any of those requests to insurance for approval. So next was Ashley. She was the diabetes navigator at St. Joe's, and she handled diabetes education and coordinated care for like diagnosed diabetics who qualify for her program. So a lot of these are mostly employees of the city of Savannah and Chatham County employees. So like if they work for like the city or the county, they're probably going to be eligible for this diabetes program if they get a diagnosis. So her daily grind was she saw patients all day in like hourly time slots for like checkups, and after triage and they get their A1C blood draw, there was just so much information and a lot of questions. She asked a lot of questions. So about like medication adherence, any lifestyle changes, their diet and exercise habits, verifying foot exams, eye exams, weight management concerns, anything that has to do with diabetes. She was like asking questions and actively charting on this stuff to update these notes, because these appointments are quarterly for them. And then how all of those different things factor into their diabetes management personally. And then, she opened up to the patient's questions and concerns as soon as they had them. Anytime they had a question or concern, we kind of built off of that and started talking about that. This was pretty much rinse and repeat from patient to patient. The charts were updated, and then on to the next one. Most of the interprofessional collaboration that Ashley experienced with diabetes management was with a dietitian who was in the next office over, because that's another part of this whole diabetes program system appointments, is they were going to see Ashley for just general diabetes education and management, and then they were going to go see the dietitian as well. Also, she made a lot of calls and did a lot of internet stuff to get a bunch of supplies like lancets and test strips, because she has to be able to administer all those lancets and test strips so that patients have enough until their next quarterly visit. So she made sure that they were good with, their prescriptions, making sure they were going to pick up their prescriptions, making sure they had all their testing supplies, any sort of, anything they needed to manage their condition. I say these two roles between Ashley and Beth, they were very similar in that they took responsibility to coordinate all the necessary follow-up care, right? So Beth was making sure that they were good in the next place. Ashley was making sure they were good until their next appointment. I'd say they were different because Beth at case management was ultimately making sure that like the inpatient patient's transition to the next destination was handled. And then as soon as she set everything up, and as soon as they were good to go when they left, like she was done with that patient. But Ashley just saw the same patients continuously, like every 3 months for checkups because of their chronic condition. So she made sure they were good until their next one, and she was more invested in seeing the progress between her visits. So they have very different function as well. I had such a great time learning about these nurses because I only ever heard them get called by the nurses on the floor, right? Like these are the nurses with the lunch breaks. These are the nurses that get the lunch breaks. These are the nurses that have the 9 to 5 or something like that. And so it was really neat, like learning how much they actually do, and I think how important they are to the whole patient care process, and delivering, fill in all the gaps and providing some of the abstract education that we don't just, bedside is one thing, and then this is a whole different kind of education, I think, and it was really neat to learn about. I think these clinicals are so valuable because, understanding what other nurses like case managers do that aren't just bedside and floor nurses, and I think that this class should not just be an elective grant, a grant elective. I think this should be like an actual nursing program class. So I went a little bit over 6 minutes. Sorry. Thanks. Have a good night.